and thanks for joining us on Medwatch today. I'm Vanessa Villafuerte. 69-year-old Bob Putnam suffered from arthritis and knee pain for years, but now, with the help of the orthopedic team at Clovis Community Medical Center, he's back to his active life he loves. Bob had been coping with knee pain for nearly a decade, but when he started changing his lifestyle, he knew something needed to change.
You know, my arthritis has been coming on for many years. So 10 years ago, I had arthroscopies on my knees because of meniscus problems, and they told me eventually you're going to need a total knee. And then a couple years ago, I was really starting to hurt a lot, and I was starting to walk funny and limp and not take stairs.
Bob, a nurse at Community, started to explore the idea of a total joint replacement.
So just full disclosure, I'm a nurse and I work here. So I know people in the industry, and I asked around as to who people would have do their surgeries and where they would have it done. And even though I work here, I would have gone wherever was the best place and went to the best physician that I could.
That physician was orthopedic surgeon Dr. Raj Amin with Community Health Partners, who first worked with Bob on non-surgical options.
So I knew Robert for about 2 or 3 years before we did surgery, and he came to me with knee pain. And over the 2 or 3 years that we had a patient-doctor relationship, worked on non-surgical care, balancing his activity level versus the pain that he was having.
After exhausting other treatment options, Bob and Dr. Amin agreed it was time for surgery.
I think eventually he got to a stage where we had exhausted everything that was reasonable to do besides surgery, and he had pain that was limiting his activity. He's a very active guy, so we balanced the risks and benefits at that point and then decided to go through with surgery because of his knee arthritis.
After surgery, Bob says his life changed.
I do 10 to 20 flights of stairs a day. I'm able to ride my bike. It got better, and it got better. It just wasn't quick, and it took a lot of work.
He says his recovery is all thanks to his care team, including the care navigators that made the process so smooth.
The navigators, the whole total joint team is this, it's like a partnership, and it made it seamless. I can't imagine having to have arranged getting all my equipment that I needed afterwards, arranging physical therapy. All of the information I got beforehand was just invaluable.
Clovis Community has a nationally recognized reputation for being a total joint center of excellence since 2017, providing high-quality hip and knee replacement surgeries thanks to their multidisciplinary approach. Nurse navigator Melissa Lebar says it's the team that makes all the difference for their patients.
The Center of Excellence really is a true definition of a multidisciplinary team, and our job is to coordinate between all the team members to get the patients having a joint replacement program through the program successfully, educate them before, during, and after, so they have a good experience while they're here with us and when they go home.
And seeing patients like Bob thrive makes it all worth it.
It's great to see him back to his active lifestyle. Seeing him for a couple of years just limping and being in pain, that was really hard to watch. But seeing him so active and really happy that he had the procedure, it's a good feeling.